Take it away, Dr. Blau.
Okay, great. Can you guys hear me? Great. Awesome. So today I'm going to spend some time talking about dietary supplements. The reason I had chosen this topic to discuss is that I wanted to it was something that came up in clinic for me, and I realized that I knew basically nothing about dietary supplements. And so I decided that this would be a good way to learn a little bit more about it myself. And it's not something I've otherwise had interest in. So let's get started. I think that I want to let you know the focus of today's talk in terms of some of my objectives for you all today. So one thing I want to do is list some common herbs and supplements that are taken by patients that you see in a primary care setting, just so that we have some familiarity with things that we're going to hear about and patients are going to ask you about. Identify reliable resources for doctors and patients to seek information regarding the safety and efficacy. And so this is really important, being able to parse that information out, or what information is available in terms of the both information that's directed at providers, at doctors, and also how to provide patients with information about some of the supplements that they're interested in taking or are already taking. And then be able to appraise that information, and how do we give recommendations on safety and efficacy, and what to counsel our patients on. All right, so let's get started. Again, feel free and interrupt me through the chat or through just unmuting yourself and asking questions. I have no disclosures. So let's start with some definitions. So today I'm talking about dietary supplements and encompassing dietary and herbal supplements as well. The definition, these are things that are taken orally and made to supplement the diet and have one or more dietary ingredients. So these are including vitamins, minerals, herbs, botanicals, amino acids, enzymes, or any extract of these. So the definition of this is purposely really broad to encompass quite a few things, and really just things that get labeled as dietary supplements. So let's talk about some data real quick by the numbers. So about 76% of US adults used herbal or dietary supplements over the last year. And this number varies. I looked at a lot of different resources to try to determine where that number gets pinned down. And it seems to be anywhere from about a third to half to up to 76%. And that number just certainly does appear to be rising every year. So this is really, really common. And at least half to a majority of your patients are going to be taking these. And then by the numbers, it's a huge industry. So there's, in 2018, herbal and dietary supplements made $8.8 billion in total sales. So there's also a huge market for this. So let's talk about the reasons why people tend overall to use dietary supplements. The primary reason is to promote overall health and wellness. But other reasons people use it are to fill a real or perceived nutrient gap, to increase their energy, bone health, heart health, and then really we could fill up this slide with any number of conditions, athletic performance, any sorts of other causes. But these are generally the most commonly cited reasons by patients. So let's talk about regulation for a moment. In the early 1800s to 1900s, it was really the Wild West. Snake oil salesmen sold actual snake oil, and cocaine was marketed as an over-the-counter treatment for all sorts of ailments, including toothaches, depression, sinusitis. So this really seemed like the best time to be in practice, and things have gone downhill from there. If we move on into more of the modern era, in 1962, there was the Kefauver-Harris drug amendment that was passed by Congress. So this was in response to thalidomide, which was a drug that was being used for nausea in pregnant women and led to limb defects. And so this led to this amendment that required proof of safety and efficacy for prescription and over-the-counter drugs. Herbal medicines around this time were reassigned as food supplements and had a lower threshold of required evidence. And then kind of the biggest, the most important legislation that currently regulates some of the herbal and dietary supplements is called the Dietary Supplement Health and Education Act that was passed in 1994. So basically, in the early 90s, the FDA was really pushing to have stricter regulation of herbal products. And this was met with huge opposition from consumer groups and also supplement manufacturers. This bill was passed, but is really a watered down version of what the FDA wanted to pass in order to kind of further regulate dietary supplements. What this bill does do is it made dietary supplements a distinct category from drugs and required them to state things like kind of the disclaimer that we're all familiar with. This statement has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. So that's really where we're at with dietary supplements now. But the companies that produce these dietary supplements are still allowed to make kind of broad health claims like promotes circulatory system health or things like that. This is just an example that I pulled from the internet of Solar Ray circulation blend for a healthy, steady flow, which who knows what that is really trying to mean. I think a couple other things that are important about this act that I want you guys to make sure to know about is there's no obligation to report post-marketing effects. Some companies do, some don't, and so there's a lot of difficulty in trying to pull dangerous or kind of uncertain efficacy products off the market. There is a way that the FDA has, and I'll talk about this a little bit later, has pulled off some supplements that are dangerous, but the burden of proof is on the FDA afterwards to prove it's dangerous, not anything that on the companies to prove safety before going to market. The last thing I wanted to mention about this is just to make sure that everyone knows that dietary supplements aren't approved or reviewed by the FDA. But that's not really common knowledge. A survey from a few years back conducted by the FDA showed that about 54% of Americans believe that the FDA approved and reviewed their dietary supplements. So it's important to know that people often take these thinking that they're kind of safe in the same way that they see, you know, Tylenol on the shelf next to some of the dietary supplements. So let's talk a little bit about what you guys should be doing in clinic. I didn't do this for a lot of residency, but I've started to try to do this a bit more now, is really to ask about what herbs and supplements people are using. I use it kind of as a separate question than what medications are you taking, because people often won't kind of offer up that information when you ask about what medications they're typically thinking about prescription meds. So I ask about herbs, supplements, vitamins, minerals. And I think it's really important also to ask about why they're using them. So we talked a little bit about some common reasons that people are taking them before, and it may make sense, you know, if someone's taking a multivitamin, they're saying, you know, I want this for my overall health. But if you ask about why they're using it, may reveal another concern that you might be able to address. Maybe they're having lower urinary tract symptoms and are trying an over-the-counter supplement for that. And that might kind of open a doorway into being able to offer them other medications or other workup that might have a benefit in their life. And then let's talk overall about recommendations. So, you know, this was really hard, and kind of the trigger for me wanting to talk about this was being asked to recommend for or against a supplement that I didn't know anything about. And in general, there are a few products that can be recommended as safe and effective and of good quality. And there are a few products that can be recommended as kind of unsafe, ineffective, or particularly unsafe with other kind of drug-herb interactions that people are taking. But the issue is that the majority of herbal products, we just don't have enough information to recommend for or against. And so you're left with this big question mark of kind of uncertainty about what to tell patients. And I think that the important part is to counsel on that uncertainty. A lot of these don't have the trials that we talk about with some of the other drugs that we use. So, oh yeah. All right, so the other big thing that I want you guys to take away from this talk, and I think the thing that, if you don't remember anything else, is to be able to use this tool. There's something called the Natural Medicines tool that University of Washington subscribes to, and it's a great resource to be able to look up virtually any herb or supplement. And for some of the more common ones, they kind of have a professional nomograph that is going to give you a lot of clear information, and also has patient handouts that are kind of easy to read, and really could be something you just print off and hand someone. But for rare things, they still have actual brand names, supplements, and kind of the information that they have on this. It's really easy to get to. You just go to hsl.uw.edu, the Health Sciences Library, and it's actually on the front page. So put a big arrow pointing to where that is. And so next time you're kind of encountering a supplement that you don't know about, I would advise to go there, and it's just a really quick resource to get on there. So now I'm going to transition into just discussing a few of the common supplements. Question: is there a link on the Epic homepage as well? Maybe, I don't know, but it is really easy to get to, and I think I tend to start even medication stuff on UpToDate, and that's just not the best place to look. I would choose this Natural Medicines website. Yeah, so I want to talk for a few minutes about some of the common supplements that might be encountered in primary care clinic. We're going to kind of review uses, evidence, and safety. Overall, just a disclaimer about this, the uses are going to be just kind of not what they should be used for, but what people tend to use them for. And the evidence, you're going to hear me say things like some evidence, strong evidence, or possible evidence. They're really overall vague. That's kind of what the Natural Medicines website tool uses, because a lot of these studies, if they're there, are really small studies and are not always the kind of gold standard randomized double-blind placebo-controlled trials. And then safety profile is often just kind of likely safe or likely unsafe, and so it's pretty broad. So we're gonna, we don't actually need you guys to post in the chat box, but if you want to try, we'll try a little bit of name that supplement based on the pictures. So I'll give you guys a few seconds to see. We're looking at a supplement that's derived from this plant. Ginkgo is a good guess. Aloe vera is a good guess. Palm, I like palm. Oh yeah. So Dr. Cho got it with saw palmetto. So this is the American dwarf tree. And the saw palmetto is derived from the berries. So let's talk a little bit about the history of saw palmetto. It was first used in 15th century BCE for urinary symptoms. So this has been around for a long, long time. The use primarily is for urinary and prostatic issues. So we think about things like BPH, chronic prostatitis, prostate cancer, androgenic alopecia, and sexual dysfunction. The evidence is, it was actually kind of interesting reviewing this. There's some evidence for reducing complications in TERP. They actually did a study where they looked at people who they had take saw palmetto for 2 months prior to TERP, and found that it decreased kind of blood loss, intra-op complications, as well as length of hospital stay after TERP, which was pretty surprising that they were able to kind of show some of that evidence. But then the question, and the kind of most common reason that folks take it, is probably BPH and lower urinary tract symptoms. And the research is both limited and contradictory. So some small studies show benefit, some don't. And the larger studies that have been done have not shown benefit. There's really insufficient evidence for any of the other uses. So I think this was a good example of, if you have someone that's taking this for urinary tract symptoms, it might be a good segue into trying to discuss kind of our more traditional things like tamsulosin, and making sure that we're able to treat some of these symptoms with medications that we think are proven to be more effective. In terms of safety, it's likely safe when used orally at recommended doses. The side effects are usually pretty mild and include things like dizziness, headache, and GI upset. One interesting thing is that it may slow blood clotting. So if you have patients who are taking this, you should actually have them stop taking it a couple weeks before getting surgery done. And then there's a caution with anticoagulant and antiplatelet drugs. So that might be something to look at for folks who are taking those medications. All right. Our next one here, didn't it reduce blood loss during TURP? Yep, I'm not sure if that has to do with kind of the fact that we think it has some effect on the prostate, but yeah, but I'm not sure, Matt, good question. And then John has a comment. Yep, yeah, I totally agree, John. A lot of these observational studies, and we'll talk about this a little bit more later, is that there's kind of who's taking them and whatnot is often a little bit confusing and doesn't yield a lot of great evidence. All right, so moving on to the next supplement here. This is a flowering plant. I've got some favorite AKAs as listed on the natural medicine site. This one was, my favorite one was called the Demon Chaser. Any guesses about what this plant is? I'll give you a hint. It's sometimes used for depression, mood disorders, menopause symptoms. Yeah, excellent. You guys are both right. So this is St. John's wort. As we were talking about, its uses are really varied, and I think I found more uses for this than any other supplement that I was researching before this talk. Depression, heart palpitations, mood disorders, menopause symptoms, OCD, seasonal affective disorder are just a few of the many purported uses for this. Actually does have some evidence behind some of this. The best evidence was for depression. It seemed to be better than placebo and maybe as effective as a low-dose TCA or SSRI, which I was really surprised about and kind of looked into the studies a little bit more on that. That data came from a 2008 meta-analysis where they looked at a bunch of studies across 29 different countries. But then they did a kind of subset analysis of the studies that were in the United States. And for whatever reason, the US trials didn't show any efficacy. So I'm not sure how to interpret that, but you know, if we're trying to interpret our population as best we can, it probably doesn't have, it's probably not the best first-line treatment for depression. There's some evidence for menopausal symptoms and somatic symptom disorder as well. In terms of safety, it's likely safe. Some of the side effects include insomnia, restlessness, agitation, GI upset, so a lot of similar things. The thing that should kind of ring a bell from med school is that it's a cytochrome P450 inducer. So this is going to decrease the effects of a lot of drugs, including oral contraceptives, antiretroviral therapy, warfarin, and tacro. So I think this is a really important one to be making sure if you do have patients on this or patients who are taking a lot of supplements to be making sure that there's not any herb-drug interactions that are going to affect some of the medications that people are taking. All right, what about this one? Yeah, great, you guys got this. So this is the GINGKO biloba, beautiful tree. It is also very, has been around for a long time. Uses are primarily, think about things that are kind of CNS and overall dementia, memory loss, headache, mood disturbance, depression. There is some evidence in a few different conditions like anxiety, dementia, even PMS and schizophrenia. But many people take it for kind of just mental sharpness or concern about age-related cognitive decline or mild cognitive impairment. There's no evidence to support those uses in patients. In terms of safety here, again, likely safe when used orally, pretty similar side effects as we've been talking about in terms of GI upset and headaches. There are some medication interactions, so it could be useful if someone's taking this to plug it into an interactions detector to check if there's interactions with any of the medications. And then this one, kind of seemingly more than others, is often adulterated with other ingredients, which reduces efficacy. Let's take a quick segue here to talk about some of those issues. So we again, one of the issues overall with dietary supplements is a question about, are you getting what is being advertised? And so sometimes some of the journals that I saw have looked at certain medications. One I looked at recently was kind of black cohosh, and whether that you're actually getting what you think you're getting. And the problem is that a lot of these you don't. When they do kind of the chemical analyses on them, it's often either it has other substances in it or closely related substances, but you know, you're not always sure that you're getting kind of what you think you're taking. All right, this one's an easy one. Won't make you guess. This is not actually what the pills look like, but we're talking about fish oil here. So fish oil in general is a dietary source of omega-3 fatty acids. It's often used for hypertriglyceridemia, kind of cardiac issues, and more rarely, not one that I'd heard about before, is bipolar and hypertension. The best evidence is for hypertriglyceridemia. It actually has been shown to reduce triglyceride levels about 20 to 50%. And it contains these two components, omega-3 fatty acids of EPA and DHA, that are found in fish oil. And so these are actually an example of kind of when dietary supplements have been manufactured by the pharmaceutical company. There's a drug called Lovaza that contains these same two omega-3 fatty acids, and is approved as an adjunct for folks who have really high triglyceride levels that aren't controlled on other traditional medications. And I agree with Shanansa's point about the prescription, so you know what you're getting. In terms of safety, again, likely safe when used at less than 3 grams daily. The side effects are a fishy aftertaste and actually not a lot of major interactions. Okay, so next supplement to talk about, this is a bowl of cranberries, favorite AKA, the thing I wish I hadn't just spilled on my shirt. So really we're going to talk about cranberry here as a supplement. The use is primarily UTIs. And let's talk about evidence here. So it does decrease, studies have shown it does decrease UTI recurrence by about 1/3 in women with recurrent UTIs. These have not been high quality studies. There's no role for treatment of an existing UTI. In terms of safety, it's cranberry juice. But actually a couple things on that. It's typically not just cranberry juice. It's often taken in pill form. And then there may be some conflicting evidence on whether there's any interaction with warfarin. So I'm not sure what I would advise patients to do who are wanting to take that and on warfarin. Next supplement here is biotin. As we go through some of these other supplements, it's hard to take a look at pictures, and we're really looking at capsules here. But biotin is vitamin B7. And so let's talk about some uses here. So biotin is a cofactor involved in fatty acid synthesis and gluconeogenesis. People often use it for things like hair loss and brittle nails is probably the most common reason that you'll see people using it. Diabetes, depression as well, and then biotin deficiency. The best evidence is for true biotin deficiency, which can be associated with pregnancy, people who are on TPN for a long time, malnourished, or having rare genetic conditions. But it was a little bit confusing. There's unfortunately not a good lab test. You can't just order a biotin level and decide that someone's deficient in it. So it's often, when it's being used in kind of the right clinical setting. There's insufficient evidence for the main reasons that we see people using it: hair loss, brittle nails, diabetic neuropathy. All right, and so in terms of kind of the safety of this, it's probably safe when used orally or on skin at the recommended doses. The lab testing interaction is kind of the interesting thing that, yes, absolutely, Kim, exactly right. So it may interfere with lab tests, things like vitamin D level, TSH, troponin, and B12. I highlight troponin here because that one seems to be one that's particularly important to get an accurate assay on when you're testing for it. The recommendations are to avoid use 72 hours prior to testing. I don't know why, James, why it interacts, but I feel like that avoiding use 72 hours prior to testing is helpful for some of these labs and pretty unhelpful if you're concerned about having a heart attack. But that's important to know when you're kind of testing for some of these other things. The last specific supplement I want to talk about is coenzyme Q10. Awesome, thanks, Nikki. I didn't know exactly why it interfered. So CoQ10 is a fat-soluble compound. It's kind of chemically similar to vitamin K. And people use it for primarily cardiac reasons, so heart failure, chest pain, high blood pressure, but also use it for kind of statin-related adverse events. So I'll talk about this a little bit. The efficacy, again, likely effective for true coenzyme Q10 deficiencies, as well as actually mitochondrial myopathies. Possibly effective in heart failure and diabetic neuropathy and fibromyalgia, but probably ineffective for the statin-associated muscle events. So some people take it to try to improve myopathy associated with statin use, but there's really not any good evidence for this. There was an interesting study that I read where they did a crossover study for people who were reporting statin-induced myalgias. And they first started by taking people, giving them a statin or a placebo, and then seeing what they would report in terms of whether they were having myalgias with that. Of that group, only 36% reported those events with the statin and not with the placebo. So already there was just a huge reduction in the number of people who were felt to have a possibly true statin myalgia. And then they kept those people on a statin and then either added a placebo or coenzyme Q10 as follow-up. And there was no significant reduction in pain or TK levels or other things like that with coenzyme Q10. So if you are asked about that, I don't think there's much evidence to support any change with statin associated muscle event. In terms of safety, again, likely safe orally at usual doses, same side effects as everything else, occasional GI upset. And they do advise moderate caution with warfarin. It is kind of chemically similar to vitamin K. And then also alkylating agents. Coenzyme Q10 acts as a antioxidant, and so there's some theoretical concern that there might be reduced efficacy at killing tumor cells if you're taking coenzyme Q10. So the kind of last part of this talk is to focus on some safety concerns that I want to highlight. So this is that section of what are some things that you might hear that people are on that you should really kind of raise a red flag and want to have a little bit more of a talk about, because these last supplements, you know, everything I had previously reviewed were kind of likely safe in the absence of kind of specific scenarios or kind of herb-drug interactions. So one of the ones that you guys have probably heard about is ephedra or mahuang. It was marketed for weight loss and athletic ability and was often combined with caffeine for this, and actually had some double-blind randomized controlled trials that showed a modest effect over placebo for weight loss. But it was also associated with things like hypertension, arrhythmias, MIs, stroke, and seizure. So it was banned in 2004. Interestingly, some of the kind of athletic performance supplements, especially kind of multi-drug or multi-ingredient ones, have been found kind of over the internet supplements to sometimes contain this. Other things, as we were just talking about, just to reinforce the fact that herb-drug interactions are something that we should be keeping an eye out for. And I'll just reemphasize that St. John's wort on the P450 system, and then GINGKO biloba on some of the antiplatelet, antithrombotic effects can interact with our warfarin, NSAIDs, and aspirin. And then I want to talk a little bit about liver injury. I think every year I'm usually at a kind of morning report where we talk about a drug-induced liver injury that's ultimately felt to possibly be related to herbal supplements or dietary supplements that people are taking. there's three main things that have been implicated in this drug-induced liver injury, and it tends to be kind of green tea extract supplement, anabolic steroids, and then these multi-ingredient nutritional supplements. So these are things that are kind of marketed for weight loss or for athletic performance and just contain a multitude of ingredients. Green tea extract comes from the leaves of a Camellia sinensis plant, and it's usually indicated, or the people use it for fat burning and weight loss, but there's not really studies supporting that. It's really rare to have liver injury from these things, but if you do, it kind of looks similar to an acute hepatitis-like liver injury. Often starts about 1 to 3 months after you start using it, and they don't really know what the cause is or why it occurs. So that's one thing to kind of be looking out for if you're admitting someone with a new liver injury that you're trying to figure out what's going on with them. Anabolic steroids also can cause liver injury. This is usually more of a cholestatic picture. And so you can get a really profound hyperbilirubinemia with a relatively minimal elevation in your liver enzymes. Death is really uncommon from this, even if you do have it, but it can cause really severe jaundice. So making sure that you're kind of asking about those things as part of your typical questioning when trying to figure out the cause of new liver injury. Finally, I wanted to spend a moment talking about, I feel like I've painted some of these in terms of some dangers of these and some lack of regulation, but I wanted to just remind everyone that we do get kind of prescription drugs that we use commonly from plants, and to just remind you guys of a few of these. So this is a belladonna plant. Do you guys know what drug is derived from this? Atropine. Yeah, Rita, you got it first. Great. What about this one? This Hasib has recently called a really pretty flower. Yeah, excellent. So this is the digitalis flower, and we get digoxin from this. And then finally, this is Jimson weed. Does anyone know what drug is derived from this? Hasib, yeah, no, I totally agree with you, Hasib. Yeah. So Jimson weed is where we get scopolamine from. Great. So I'm gonna end this talk with a video that we're all gonna watch from Mel Gibson. This is kind of a commercial that was aired as a lead up to that 1994 congressional bill, just to kind of show what the opposition was like to this. So give me one sec to pull this up. And if it's not working for you in terms of being a little bit too laggy, I'll put this link in the chat box as well. Okay, are you guys seeing the video right now? Yeah, can I get a thumbs up, Courtney, if you are? Great.
Yeah.
Okay.
Got it. It's only vitamins. Vitamin C, you know, like in oranges. If you don't want to lose your vitamins, make the FDA stop. Call the U.S. Senate and tell them that you want to take your vitamins in peace. If enough of us do that, it'll work.
Yeah, so the point of showing you that video was just to talk about how, yeah, this is a...
Tonight,
oops,
there is reason
sorry,
for
1
hope.
sec.
Things are very much in flux, but we have never heard what we've heard.
Yeah, just to show you guys that this was not the last time. There was quite a bit of dramatization around this. And yeah, Rita, to answer your point, this was part of that backlash against things and part of how that 1994 law got weakened. So that kind of concludes my talk. I'll open it up for questions and see if I can help answer things. But thank you guys for listening. Yep, and I'll kind of just read out the high points from Dr. Cho in terms of perioperative, ask people to stop supplements, specifically asking about fish oil and vitamin E with increased risk of bleeding and St. John and ginkgo because of the interaction. So that's great. Awesome. Well, thank you guys so much.
Great. Thanks so much, Kevin. And thanks, James. The great morning of talks. And thank you, everyone, for joining. You now have an hour to take care of your wellness. So go back to bed, catch up on whatever, go outside, enjoy the rest of your morning. Thanks for joining us this morning.